So what you want to see over here is how to properly drain a blister. If there is any infection, you don't want to go from the area of the infection. This is a wart over here, and he had a treatment that was very effective to separate the wart from the blood supply. Now, it causes a lot of tension. It's as if your foot became pregnant, but overnight almost about to deliver. You don't want it to pop. You don't want the fluid to pop, because then their skin will rip and it will take forever to heal. But if you decompress it, it's painless, and you take a sterile needle. Now at home, what you can do is you can do with a sewing needle, but you have to heat it up and you have to cleanse it with alcohol. And it's not going to be wide enough. It's usually a narrower bore needle. And then what you do is you simply put a little bit of a poke in here, and you can right away see. Is it painful to you?
No.
Do you feel now the pain from the needle?
No.
No, you don't feel the pain.
Okay, I don't feel
The truth. Do you feel the needle?
No.
No, you didn't feel the needle, right? Now you got to tell the truth. So now what it feels is it's going to be slowly much better. But you want to make sure that the needle does not go through the wart, because I've seen some people do it and they've spread their warts. So you want to make sure that you do it on the sides, not in the wart itself. And slowly just make sure that you put it through and through, and you go through the dead skin. So when you do that, it feels comfortable because you see clear fluid, so it's not infected. And then it kind of, separating the skin hurts, but he's got blisters on both sides, and we're doing the same thing, and slowly will leak out. But putting this and not separating the skin allows the skin to remain as a bandage on top. And now I'm going to go over here as well. There's an area there too. And so this kind of gives it a couple of airs. Now when the air also enters, it also allows the skin to heal faster, because it exposes it to the elements, and the skin underneath will be able to take over the function of being a dry type of skin a little sooner. It's kind of like, imagine your lips, they're moist all the time, and if you expose them to the dry air, they become a little harder. So the same thing over here. We want to expose the skin, the baby skin underneath this blister, a little bit to dry air slowly, and then it's able to get better faster. So let's go ahead. So you did very well. Now let's go turn a little bit to the side, and then there is a blister here as well. So now you see it's deflated. It used to be huge. And now we're going to do the same thing over here, just gently. And there should not be a blood. If you do it correctly, there should not be any blood coming out. And you see the fluid is clicking from here as well. Now you don't want it to macerate the skin. Now obviously I'm putting tension on the toes, so it hurts. There's just the spreading of the toes. Just try to relax the toe as much as you can. It's not easy because it's tight already, and when I'm spreading it, it's a little more tight. You see there's no blood. The reason it's no blood because this is already dead skin. It's separated from its blood supply. And that's about it.